thank you guys so much for taking the time out of your busy day to jump on these. We try to do these every 8 weeks or so. Sometimes it's more like 10. But again, as Guardian is growing and expanding, as we're doing more and more, we really want to make sure we keep you guys apprised as best we can. With these medical director meetings too, I always want to start with like, thank you guys. I mean, you guys really don't know, and we try to share it more, and we will continue to try to share it more. But like, how much of a difference you guys make. I mean, we have really had some amazing stories shared with us, even in the last couple of months, of patients who have been able to access care where they couldn't have otherwise, of clinicians who have been able to really deliver care in very important ways. Even, you know, amongst the biggest one for me was with the hurricanes. So we actually, because of the work you guys do as medical directors on our platform, we had some nurses and nurse practitioners who are really enabled to be able to kind of respond in their communities and do a lot of great work. And again, that really is a testament to your guys' willingness to come alongside other clinicians and really empower increased access to care that people desperately need. So first and foremost, as always, thank you guys so much for everything that you do. I'm going to pull out a little PowerPoint presentation here and share my screen. So today I've got a couple great things I want to cover. Let me see if you guys see my screen. I need a verbal yes from Archie or Mary because I can't see you guys now.
Yes.
Perfect. Awesome.
Yes.
So a couple of things we want to talk about today. So the first thing I wanted to do is talk about, well, really introduce our new VP of Client Experience. Many of you have already probably spoken to him or gotten some information from him, but I wanted to kind of officially present him here today and have him spend just a couple minutes talking about really some big, exciting things we're doing to enhance our client onboarding. Onboarding is one of the most difficult things, and it should be, because that's where we verify compliance. So we've really done some amazing things, and I'll have him speak on this, to really help clients from start to finish get set up in the correct way, where we know that then on out, they have the right compliance pieces in place, that they've been empowered with the right situations, and that we have what we need. So I'll have him speak on that for a little bit. I want to talk about our new EMR integration. Big announcement this past month is that we partnered with an EMR company to now offer EMR services to our clients, with the goal of having that really enhance how we do medical oversight and compliance. Having access to the patient data, also having access to be able to pull telemedicine visits that we're doing for clients directly into their EMR, and really start to kind of get some insights there. Excited about that. I'll talk about that for a little bit. Some changes that are coming to the clinical help desk that I will talk about, and then Mary will be giving us a compliance update as well. We're doing a lot of stuff in the compliance space to really kind of revamp how we continue to update it. As regulations are changing, we want to keep you guys apprised. And just so you know, we are always staying apprised of that. So, you know, she had some updates she wanted to give on the compliance side, things we're seeing happening in the different industries that we serve, things that we're doing to protect your guys' licenses and things like that. And you know, some things that we might need from you moving forward as well. So I will stop sharing my screen now, but I would like to turn it over to Archie. So I'd like to introduce Archie. He is our new VP of Client Experience. He's been with us for a few months now, but really in the last probably 4 to 6 weeks has really taken our client experience from a sales through onboarding standpoint and really started to kind of revamp how we do that. So he's been an amazing asset to the team. We're very thankful to have him. But Archie, I'd love for you just to take a moment, introduce yourself, and then maybe talk a little bit, I think specifically the big 7, the things that we're really working with clients to do as they come in as brand new. I've done this before, I've never done this before. What do I need to do to succeed? And really, again, we always say you need to be compliant to succeed. So how we're helping them kind of get through that. So.
Yeah. Well, as you heard earlier, my name is Archie Messersmith-Bunting, and I do not have a medical background. I used to be an actor. I never played a doctor ever. So like that is not my world. My world is compliance and really operations. But then coming here, like really understanding that Guardian is built on a bedrock of compliance, and if we don't start compliantly, then we're on the wrong track. So when, as Chris said, I've been here for 4 or 5 months now. And so when we began to like, moving into this role, he said, "Do you think our onboarding process is broken?" And I said, "Well, no. Do I think that the education we are giving people when they become clients is broken? No, I don't believe that's broken. I believe the next 90 days is broken, because what what we see is that for someone that this is literally Greek to them, if they're like, I'm going to open a med spa, I'm going to open a whatever, it is not like opening a Chick-fil-A. Like there are so many pieces of this. And so what we've really done with our onboarding team now is when we meet with them, we say, okay, we call it the big 7. These are the 7 things that you have to do before you see your first patient. If you do not see these 7 things, you are not in compliance. And so we really try to make it like really sticky and really, really common sense. We talk about when you join Guardian now, you got to pay your security deposit and your first month's rent. And the very first thing you want to do is invite a nurse to be your roommate, because until you do, nothing happens. So we've really tried to take things that people understand from their world, make it really sticky in the onboarding process. And then our team follows up with them 7, 30, 60, 90 days. So we reach out and we say, all right, Janet, I see you got 3 of the 7 done. You got these 4. What's going on? And then by day 60, if you still haven't uploaded your insurance, if you still haven't uploaded protocols, we're like, what are you doing? You better not be seeing patients. Like, what is happening? So really like zoning in like compliance. And from the beginning, I think that also puts in the mind, because as you know, we have 2 kinds of clients at Guardian. We have nurses, nurse practitioners coming from the hospital, or we have entrepreneurs. These people don't know anything about medicine. These people don't know anything about business. So when we're trying to like match those 2 in the beginning, and I say that jokingly, like most nurses have never started a business. So like, what are the things that like we have to do today? So that's really the approach that we're taking. They communicate with us a lot more now. And they'll say like, hey, I submitted this document. Do you know when my doctor's going to get to it? And we say very lovingly, your doctors are human beings as well. So let's just give this a minute, and then we'll like work through the process. But it's an exciting time. We're already seeing results. We're seeing people that joined 28 days ago are fully compliant, ready to see a patient. They have all the things they need. And for all of us, for the longevity of Guardian and everything, that's really exciting. So super excited to be a part of the team. Looking forward to getting to know you more and support you more.
Awesome. Yeah, thank you, Archie. And again, yeah, absolutely. We appreciate having you here. And again, a lot of this has become second nature to us, but it's educating and re-educating and re-educating. I always say that at the heart of everything we do is education, right? As clinicians, right, whether we're educating patients on, what they need to do for their health, but even as, like I said, as a company, really educating the clients, both as clinicians and business owners, as Archie said, to really, how do we make sure that both your business and the way that we're delivering medicine is safe and compliant and efficacious and that type of thing. And again, I'm very proud of the work that we're doing. I'll always find 8 things we can improve on, but that's my job. So that'll be my promise to you guys, is that we'll keep iterating on this over and over and over again. But very excited about where we're at and kind of what we're doing. To that note, actually, I'd like to share. I think sometimes like we say that, and then it's like, okay, but like how do we know if that's true? How do we know if we're hitting that mark? And actually, what I'll do, instead of leading it to the end, Mary, I'm going to turn it over to you. But before I turn it over to Mary, Mary's our Chief Compliance Officer, and Mary has been asked to come and speak to the California Attorney General's office and their medical board investigators to educate them on corporate practice of medicine. So, like, to me, I was just like, hey, I mean, that's pretty good. That's pretty exciting. We also had the opportunity to sit in front of the Texas Medical Board. And left that meeting with one of the physicians who sat on the board saying, hey, what you guys are doing is really important. And we see so many clinicians come in front of us who don't know what you guys are educating to and what you're offering. And like, keep going. That's really awesome. And that, to me, like that, again, you guys always come first. We are very much and always will be a provider first organization. And that means we have to be compliance first. But that's ultimately what allows, I think, our clinicians and our clinics to really deliver safe and effective care. And we've had some really great success, I think, in partnering with the medical boards and the regulators and the different, again, even the state attorney general's offices to say, hey, this is something that's needed, and let's make sure we all come together to do it really well and right. So anyway, just some actual kind of practical ways that has played out, where I think, again, we always have more we want to do and farther we can go, but very excited and proud of this team and what we've been able to do. And again, can't thank you guys enough. So Mary, what I'll do, do you want me to pull up this presentation that you put together? So then you just tell me when to move forward.
That'd be great. Thank you.
Perfect. Let me share my screen again. So Mary's going to give us kind of just a general compliance update and kind of what we're seeing in the industry here. So.
Yeah. So as Chris mentioned, I think most of you probably knew me as the Chief Operating Officer for GuardianMD. And as we see the regulations and more boards coming forward with really streamlining how services are being offered in the med spa industry, IV hydration, we realize that we really need to stay on top of this. And for those of you that have ever been involved with a board inquiry, you know, I'm always first to kind of say, hey, you know what, talk to me first and let's see what I can find out. So we decided that really needs to be a full-time job. So a full-time position where I stay on top of compliance by state, by all regulatory boards. It's not just the medical board. You have the nursing board, you have the paramedic board, you even have Secretary of State and Attorney General. So those are all boards and regulatory bodies that we need to be in constant contact with. So that is one thing that I have committed to doing, and it's really to make sure not only Guardian Medical Direction and Guardian Medical Groups are protected, but also all of our medical directors and collaborating physicians, because that is my number one priority, is making sure that all of you are in compliance, your licenses are safe, and if you do ever have that anything with the boards, that we will make sure you're covered. So a couple things about staying compliant. Each state is different, and that's really important. We talk to a lot of people and are like, oh, well, this state, doesn't matter what that state does. Another state may be different. So really adhering to those state and federal regulations, regular compliance audits. Archie talked about the first 90 days. It's just not stopping there. So we're going to continue with the compliance audits, making sure that all the licensing for the clinics are active, making sure all their malpractice is active, and also those chart reviews. So that is something where we know we'll have clinics that don't upload chart reviews. So that is something we are putting a process in. When they become late and they haven't uploaded their monthly chart reviews, hey, you have to upload your monthly chart reviews. They're going to get a warning, and then they will get their account suspended. I know some of you on the call have actually had clinics where they've been out of compliance. You'll hear from me saying, hey, I'm going to suspend their services until their compliance is met. I think even some of you even we've canceled clinics because they're not meeting compliance. Because again, it's really important about making sure everyone is protected and addressing all those compliance issues in a timely manner. You can go ahead to the next slide. So as medical directors, we have to make sure that all the clinics practice within their scope of practice. Those protocols that all those clinics upload prior to starting services with Guardian Medical Group, Guardian Medical Group and Guardian Medical Direction, prior to them starting seeing patients, they have to have their protocols uploaded and approved. I can't stress this enough. If there is a protocol that you do not feel comfortable with, don't approve it. Put a note on it. Have Chris review it. That's really, really important, because we do not want any of you feeling uncomfortable with the service that a clinic wants to offer. And then making sure, again, with those chart reviews that those charts are done correctly. If you see something that doesn't seem right, don't hesitate to reject those chart reviews. We've had someone ask a question about, is it okay to reject? Absolutely. If there's information missing, if something doesn't seem right, absolutely challenge that clinic and get them to correct it or have corrective action moving forward for their charts to be in compliance moving forward. Go ahead to the next slide. Corporate practice of medicine. So right now, 33 states have active CPOM doctrines. Just because a state has a CPOM doctrine doesn't necessarily mean that it's a very strict corporate practice of medicine state. Corporate practice of medicine is basically saying corporations cannot practice medicine. It has to be a doctor. It has to be an MD. It has to be a DO. And corporations cannot own a medical practice. Guardian Medical has a practice set up in each state. So we can meet the corporate practice of medicine doctrines in each state. We have some corporate practice of medicine states that have very narrow exceptions. We have some that has significant exceptions, and we have one that are just flat out like you have to play by the book. When I talk about exceptions, I mean some states will have, if an NP has practiced X amount of hours, they can own a practice. Some say it doesn't matter if you're an NP, it doesn't matter if you're a PA, you cannot own a practice. An MD or DO has to own their practice. So when I talk about the severity of the corporate practice of medicine doctor, that's what I'm referring to. We have managed service agreements set up for those corporate practice of medicine that have their prohibition. They prohibit the practice of medicine from corporations. So we have managed service agreements set up in each of those states. And I know some of you have been involved with questions surrounding the corporate practice of medicine. Those practices are owned by Chris. So if you ever have an inquiry about corporate practice of medicine, you will hear the same thing every time, is that the practice is owned by Chris. It's Guardian Education, Guardian Medical Group, and we have a managed service agreement in place. So the clinic becomes the managed service organization and we remain as the practice.
And this actually, I'll just jump in here. This actually was something we put into place about maybe 2 years ago now. So when Guardian first started, and corporate practice of medicine really wasn't something that people understood very well. We actually, the medical directors like yourselves would actually sign these managed service agreements and essentially take on the ownership of that medical practice. In order to limit your liability, though, and as things started to advance with better understanding of corporate practice of medicine and better regulations and restrictions around it, that was one something that Guardian made the choice was, hey, you know what, we don't want that liability falling to our medical directors. We want you to be able to do what you do best, which is provide high quality oversight and education to the clinics. And we would take on the liability of the practice of medicine. Where this also is a big benefit to you guys is that if there is a board inquiry, legally it's my practice. So you are able, and I would always encourage you to anyway, but to reach out to us and let us help you navigate that. Because this is another way that even in a board inquiry type of situation, I can take on a lot of the liability in conversation, and even like the legal component of saying, hey, Dr. Taylor actually works for my practice. This is something that she does as an employee, not as a directly liable party. So there's a couple of things we've done there in that regard. So if you ever get those inquiries, which we do periodically, and again, we've had a lot of success navigating and really have even turned them into great partnerships with a lot of the boards and stuff. But this gives you the ability to kind of swivel that chair and point at me. And we did that purposefully, right? So to really kind of take that liability component off.
So the final tips and takeaways from compliance for Guardian Medical Direction, Guardian Medical Groups, and the medical directors is really, we talked about in the beginning, strengthen those partnerships with all the regulatory boards. So we want to make sure that we have strong partnerships throughout each state with all the regulatory boards. Something I have done, I have subscribed to all of the medical boards newsletters. So if we see something coming up, they always announce it in newsletters, we're going to be ahead of it so we can change as fast as these states are changing. And then also restructure contracts between the practices and the medical directors. All of you, when coming on board or when we restructured back in February, there was an agreement that was signed with the practices. It was a very basic agreement to make sure that everyone's covered, everything's legal. However, we're going to take it a step further. So we're going to make this contract so strong that it is airtight. So if you would have a board inquiry, or even if we would have an inquiry of the Guardian Medical Group, we'll have a really, really strong contract out there that states exactly step-by-step what we do and step-by-step what we offer. So that will be coming up in the next 30 to 60 days. And then those state-by-state audits and the regulatory bodies, again, is really just refining those, especially in those 33 corporate practice and medicine states. Even those doctrines change. For instance, 2 years ago, Ohio was a corporate practice and medicine state. Ohio no longer even acknowledges their corporate practice of medicine doctrine. So that's just an example of, even with corporate practice of medicine, how quickly these states and regulatory bodies change. There's going to be 7 elements of compliance that we're going to be focusing on. Of course, it's implementing all the compliance, making sure we have strong agreements in place, making sure we have proper SOPs in place, and that everyone is kept abreast about all the regulatory changes by state. Compliance officer, which we've already done. The continuing education. You can't get enough education about compliance and everything regarding the practice of medicine in the states. making sure we're responding to any inquiries in a timely manner. As soon as I'm notified about the board, I reach out. As soon as I'm notified that there's been any board inquiries, and I respond immediately and get a call set up with that investigator. Or I've even talked to board lawyers before, making sure we get ahead of it. We do not shy away from medical boards. We welcome it, because if there is something we can improve on, we want to know. Like I talked to the investigator out in California, and when I talked to the attorney general, they're like, and I said, I'm actually excited about this meeting. And they're like, most people are nervous. Like, I'm not. I want to know if we're doing something wrong, or if there's something we can improve on. I want to know, because I want to make sure the medical directors are protected. I want to make sure Guardian's protected. I want to make sure our clinics are protected. So, so that was a change for them, and they welcomed that. And then it gave me the opportunity to tell them about Guardian and our medical directors and their corporate practice of medicine and what we're doing. Hence how I'm going to be speaking to the attorney general and the investigators and their lead investigator, just to educate them more in the corporate practice of medicine, because a lot of these investigators come from law enforcement and don't have a medical background. Or even the attorney general is like, yeah, I kind of got thrown in the CPOM thing. You know, we got a brief overview on it for about 40 minutes. And so there we go. I'm going to talk to them about it for an hour. And then those constant audits that I talked about. So not only auditing the clinics for their protocols, for their licensing, making sure their pharmacy forms are regulated. We want to take that a step further and make sure that all of your licenses are updated. We plan on taking the MPIs, making sure that no one is prescribing illegally under your MPI or DEA. So we're going to keep auditing and auditing to make sure we have a clean process in place. And then really communicating. If we know something's wrong or something needs to be improved on, we don't keep that a secret. We're like, hey, we found out this, and we will communicate that. And that is my that is my pledge to all of you, is to communicate more on regulatory changes, communicate more on when there are board inquiries, and just really enforcing all the things we just talked about regarding compliance. If there's a change, we're like, oh, we'll kind of get to it when we get caught. No, that's not how we're going to do this. We're going to enforce those changes and continue moving forward in a compliant way.
Awesome. Yeah, thank you so much, Mary. And yeah, this is something that you guys will see us continue to, again, iterate on over and over and over again. This is somewhat of a moving target as regulations change. So as that happens, we continue to re-audit and readjust and redo contracts and continue to move forward that way. But I think, again, what I'm most excited about with a lot of this is that this really is what the vision was for Guardian. When I started it years ago, it was, again, and the story I tell when I'm talking to anyone is that, again, the physician shortage isn't getting better, right? There's less and less of us each year. And we as a nation and as a healthcare system are going to have to turn to other providers who have a scope of practice to deliver care. But how do we do that the right way? And how do we as physicians lead it so that it's done the right way? And I think that's really what we're doing here. And again, very proud of how far we've come and everywhere we plan to go from here in that. So again, thank you guys again for that. And again, it's very exciting to see the headway we're making and the leadership role we're taking in that. I actually had the privilege of being asked to sit as the board chair for the scientific committee for the American IV Association. So again, Guardian really is taking a huge leadership role in making sure that we're guiding that conversation as a physician-led company and as the company that represents physicians to say, hey, we do believe that this needs to be done, but we want to make sure that we do it right. And we want to make sure that we're all on the same page and again, really, really pushing our entire healthcare infrastructure forward, but from a clinician first standpoint. So that's awesome. So Mary, thank you for everything that you're doing on that. So you guys will see, again, as she said, the next couple of months, we'll probably pushing out new updated contracts. We're also looking at probably pushing something out to you guys to help us do DEA audits too. Just again, we're just going to start these kind of auditing processes. So watch for that stuff. And again, never hesitate to reach out, raise your hand, ask questions. And I'll actually stop there to say, are there any questions right now? Because again, some of this corporate practice medicine stuff, any questions, comments, concerns you guys have at this time, we can talk a little bit about that if you have any.
I have a quick question.
Yeah,
Chris, it's Nadia. When we run across any kind of clinic that seems to be non-compliant, either they're charting something that's outside their scope, they don't have up-to-date licenses, something like that. I've been traditionally just sending those to Jason or to you. Should I be including Mary in those emails? I obviously reply to the clinic as well, but as you know, sometimes that falls on deaf ears.
Yeah. So again, Jason, I don't think Jason couldn't make it today, but Jason is obviously you guys probably all have heard from Jason, but he's our VP of clinical operations. So yeah, definitely send it to him. Yeah, if you want to include Mary, he usually includes Mary anyway, if he gets it. Sure. So you guys will, as Mary said, like, we are not going to shy away from reporting things even to you guys. So I know some of you have probably even got an email from Jason saying, hey, this kind of issue happened. Here's what we've done. Here's how we're remediating. Here's what's going on, to keep you guys approved of that. So as we do that, so yeah, so feel free to include Mary as well, because she's an integral part of that process. Jason really spends a lot of time re-educating on the clinical aspect of the why and what needs to improve, and then Mary typically co-steps into, from a business compliance infrastructure standpoint to make sure that stuff's all shored up as well. So yeah, absolutely. And feel free to continue to include me in there too. I'm always, actually that's our priority. So
sounds good.
One of the things I'll say too is that as again, this is our goal and this is what we're moving towards. As you can see, it also is the goal for the technology. So, and this kind of leads me into our next topic, the EMR, but I just had a great meeting with our CTO today about how we plan to revamp how documentation and protocols are done, where protocols are automatically uploaded and defaulted to protocols you've approved, and then only if the clinic edits them is there a change, and just different things like that, where we're also within the next 6 months, I think, going to revamp what your dashboard looks like as a clinician. We recognize that it's not quite as user friendly as it could be, and that's another target we're always pushing for is, can we make it so that you can easily pull up in one pane of glass your clinics, quickly see their users, their licenses. So again, our technology will always push to reflect that too. But admittedly, our technology will always lag that because technology resources are limited, and we move as fast as we can, but we want to make sure we're doing it right there. So watch for a lot of that coming in the future as well, as we start to revamp how you utilize the technology, and we'll re-educate you to it as we push changes out and things like that. So, but as a part of that, kind of brings me to my next thing here, and I'll reshare my screen. But as a part of as we move forward, and one of the things that Mary had mentioned was the chart review component. So one gap we saw was, hey, you know what? Some of these clinics aren't uploading charts, and if and when there is a board audit, that's one of the ways that we show we're doing ongoing medical oversight. So in an effort to really move towards a day where we can automate that and almost make that a requirement, we were happy to announce that we spent a lot of time vetting who we wanted to partner with on this, but we have partnered with Simple Healthcare to do a full EMR integration into our platform. What I love about the team over at Simple, so they're actually the same team who created LifeLock and then sold it to Experian. So they have a proven track record of building very compliant and very stable platforms. And their philosophy and how they're attacking the electronic health record world is really a kind of open API, non-siloed data approach, with obviously like AI enhancements as well. And why that's important to us is that we didn't want to offer our clinics an EMR if we were going to. That was just simply going to be another platform that they worked in. We wanted to be able to create a true integration with our platform and the EMR so that you as medical directors could easily at some point get access to patient data if and when it's needed. Now, obviously, this is going to take time for us to fully roll out, but we have actually already had, I think, 10% of our clinics register to integrate the electronic medical record. What this will allow us to do moving forward, and again, it's going to give us some time to do the integrations fully, but it'll allow us to start doing things like automatic chart review, and also connecting our telemedicine, the nurse practitioners who are doing the clearance exams and the evaluations for patients will be able to document directly into the electronic medical record, and then those charts can be combined. So we're very excited about this. And again, this is anytime we do any integration or technology enhancement at Guardian, it's always with an eye of medical oversight first, right? Yes, an electronic medical record is a business value add to our clinics, but really the reason for it was so that we could better drive that gold standard of medical oversight. And we believe that having access to that patient data and those charts and starting to automate some processes around that is going to, again, enhance compliance and really hopefully make your guys' job easier and stuff as well. So we're very excited about that. Again, I will push out more information both via email and on these sessions that we have together. as those integrations become more and more put together with our platform. But again, this is just an exciting thing I wanted to keep you guys apprised of as we move towards, again, this really continuing to drive a medical oversight gold standard. On that realm as well, so there's some changes coming to clinical help desk that I wanted to discuss. One thing we're going to do is a simple thing. We're going to change the name, and the reason we're going to change the name is that we realize that one of the needs that we have as a company is finding a balance. And I will actually open this up to you guys for even questions or suggestions. It doesn't have to be right now, but it can be. But even after this call, to email me. Is one of the challenges we have is that there is sometimes an expectation, and Archie's working on client expectations as we work on onboarding, but that they should be able to talk to you as their medical director at any given moment immediately. And obviously we want to protect your time, and your time is valuable. And we also want to make sure we're a part of those conversations so that we can help navigate. We've also found that 90% of the time, the question is not medically related. It's, hey, Dr. Terashenko, can you sign this form faster? Or, hey, am I supposed to have, a business license with my county? Or, some of these things that we can handle that you shouldn't have to. So one of the changes we made to clinical help desk initially was first a clinician, and it's always a clinician licensed, but we'll kind of vet that first question. Hey, Dr. So-and-so, can I get a copy of your, license? Oh, we can tell you where that is. We don't need to bother the doctor with that. For anything patient facing, anything clinically related, we always add you into that conversation. But one of the things we realized is that clinical help desk is giving people a connotation that it's just some random Joe Schmo on the other line, and that they don't have direct access to you. So one of the things we're working on, both in our technology and how we approach these things, is finding this balance between having the clients, when they need to, have as quick of access to you as they can, without just like giving them your phone number and then trust me that you don't want that, because that's happened to me once, and then they call for everything and everything. So again, I will say that, like I said, I'm interested if you guys have any thoughts or feedback around that as the medical directors. But one of the things we're doing is we're working towards kind of making that experience better, is that we feel that we're going to change the name from clinical help desk. I don't think we've quite landed on what the name will be, but something that just, I think, even in the name, explains better to the clients and know that you are accessing a clinician. It may not be your medical director right now, but your medical director can be pulled in at any time and that type of thing. Another thing we're going to do is that a lot of our now that our telemedicine platform has expanded, we have a lot of nurse practitioners who are seeing patients on behalf of these clinics every day, who also would be a great resource, who have the knowledge, both clinically and just the Guardian format, to answer clinics' questions as well. So moving forward, one of the things we're going to be doing in the next couple of weeks, actually the next 2 weeks, is that we will start to be covering what's currently clinical help desk with our nurse practitioners. So now when a client reaches out and says, hey, I've got a question about a protocol, they'll get a response back, hey, this is Lauren, the nurse practitioner. What can I help you with? Now, that being said, I want to reassure you that no patient-related clinical questions will be answered by the nurse practitioner still. They are being trained to be a clinician responding so that the clients feel that they have access to the true clinical team, but it's not their job to speak for you as a medical director in answering clinical. So you will still always be pulled into anything clinically related. Again, what we find is that 9 times out of 10, the questions we get in clinical help desk are not clinically related, and they're simply should have probably been an email to our support system, but people are trying to get a quick response. So those we can kind of field out. That being said, again, as we have, and one of the things we're finding too is that even the boards want to verify that these clients have direct access to you. And again, we believe that our clinical help desk does do that, but in a format that will actually work for you and for the clients. So I want to reiterate here that we do have a need for you guys to make sure you're monitoring the clinical help desk chat on a daily basis. Now, again, we are not pinging you guys very often at all. So I get that it's almost cumbersome because most days you're checking, there's no message for you. Again, we have an app. If you don't know or haven't downloaded the app, that's the best way to do it. You can check the chat in the web-based portal. But again, if you download the app, it's really easy. You can even set notifications, and if we do pull you into a conversation, you'll get pinged. If you're pulled into a conversation, it is critical that you respond as quickly as possible. That being said, we recognize that you may be in clinic, you may be, on shift. Again, that's why we're there monitoring it. But the quicker you can respond, the more the client feels that they have access to you if and when they need it. Now, again, why they would need access to you within a couple of minutes is a different question, because again, there should be emergency protocols in place if it's a true emergency, and anything else can probably wait a little while. But again, as we work towards making sure that we're meeting the requirements from an oversight standpoint on the state level, as well as fulfilling the need, or at least the perceived need of the client of having access to you, again, we're playing with this a little bit. So we'll be changing the name. The nurse practitioners will be providing coverage for that, so they have a little more advanced clinical coverage and can see that. But I will just encourage you guys again, please make sure you download the app. Please make sure you put notifications on. We promise not to let this ping you all the time, but when there is a time that someone does need to talk to you specifically about a clinical related question, again, if you're responding quickly, we're really doing our jobs well. So we encourage you to do that. And ignore this last point here, because this is from a previous presentation where I clearly was talking about protocols and I just forgot to delete it. So I do want to stop there again too, and you just open up for questions around clinical help desk. Does that make sense to anybody? And again, if you have even any suggestions on what could make that even better, both for you guys and the clinics, I'm open to it. Again, it's always going to be kind of finding this balance of having direct access to your medical director, but not such direct access that the medical director is like, I can't be at your beck and call either. So Alan, please.
So I just sent you a suggestion for a name. Ask a Clinician Help Desk.
Okay. All right. I like that too. All right.
This came up last night. I was talking to Jason and to Mary. It happens not too infrequently, but not burdensome. I've got a couple of clinics that think they're my best friends.
Okay.
And well, I kind of am, but that's besides. They call always wanting to know if they can deviate from the protocol. And in the old days, I would say yes, no, whatever. And then I think after talking to Mary, or I realized, wait a minute, that's my malpractice. I'm giving them medical advice about patients. Mm-hmm. So with the case last night, I said, I can't give you advice about the patient because that's not covered under my malpractice. So number one, I hope I did that right. But number two, I just discussed the nature of the case in general, saying, well, why do you want to deviate? And these are the things that can happen if you deviate. And I handled it like that.
Yeah.
I mean, it doesn't happen that often, so I don't mind that they call. Actually,
and that's perfect. And that's really the way it should be set up, right? As medical directors, we should be giving, well, first and foremost, again, what we do see this a lot and we field these a lot so that they don't get to you guys, but we get questions all the time saying like, well, hey, my protocol says this, but this patient really wants this, or this patient, and a lot of times, and this is not, this is just the nature of the beast of healthcare and business combined. A lot of times they want to deviate from protocol because they want to make the sale. And we do educate and we coach on that, saying, hey, like these protocols are there to protect you as the clinician. There's a reason we have protocols in place. Now, sometimes there are circumstances where like, yeah, actually that does make sense. I think that's okay. But to your point, I would prefer that people edit their protocols for future situations as opposed to like, pinging us for individual patient permissions. Because again, it is a liability. That being said, just so you guys know, and I'm not saying that we should change this, it should stay that way. I think you handled that perfectly. We did make sure when we just re-upped all of our malpractice for the company and for you guys as a whole. And we did address the fact that there could and can be situations where we are maybe providing direct care as clinicians, and that we made sure that was covered as a part of it. Okay. Now, I'm not saying you should go ahead and do that. I'm just saying, just so you know, we recognize that, like I said, we don't want to have gaps. You know what I mean? So we made sure that was part of the coverage. But yeah, that should be the general approach, is that clinics really should be following their protocols. In very limited circumstances would we as medical directors say, yeah, I think that's okay in this situation, and you are covered to do so. But again, a lot of times they're trying to deviate from protocol simply because they want to make that sale, or hey, a competitor is doing it this way. That then should be an update to the protocol for future situations, right? I mean, like if you want if you want to change the dosage of something, I really need to know very clearly why. And a lot of the services that we cover, it's hard for them to give me a why. It's just because, well, this is what they got the last time they went to a different IV therapy company. And, and so again, we got to be careful there. So I think he handled that perfectly. And again, you always have, I would encourage you to, like, if clients do get access to your phone number, if you're okay with it, that's fine. But you're always welcome to say, hey, listen, the best way to get a hold of me is to reach out through, ask a clinician, that thing, and revert them back to that standpoint. So, but yeah, that should be the general gist, is that really we should just 9 times out of 10 be saying, hey, follow your protocol. If your protocol is not, doesn't cover that, then it's not covered, and that's okay. If you want to adapt that protocol for future use cases, we can look at that. But mainly what we're going to need you guys to jump in on from a clinical standpoint is general education around protocols. Hey, and I think what you kind of did, like, here's why you shouldn't deviate from this protocol. This is in place because of X, Y, or Z. And then also if there are patient bad outcomes. Now, and I say bad outcomes, I mean, I think we had and this wasn't even your client. I think Jason called you the other day to ask you questions about someone got too much Botox, and they were fine. But we are very proactive about documenting near misses, and even if there's not a bad outcome. So that's one thing that Jason does really well, is that he, like, if a client says, hey, I gave too much Botox, but the patient's fine, that's still a problem. That's still an adverse event, and we need to document and address it. So sometimes, one time there was one patient had a concern about like a venous occlusion, and I think whatever medical director was able to jump on with I think that was you too. Was able to jump on with the client, just walk them through, like, hey, I think this is okay. Here's what you should do. But really along the lines of what the protocol should be anyway, not let's dive into individual patient care types of things. So you are covered to do so if it's ever, I can see that there may be some cases where it's worth talking specifically about one patient and directing that care. But here's the other thing too, because we have a full stack telemedicine platform now, you can put that liability, but you can defer that to our nurse practitioners. So feel free to say, hey, you know what? I think this patient needs to be actually evaluated and seen. Let our nurse practitioners do that. So that's one of the ways we've structured this, is the nurse practitioners work for the same medical practice that you guys do. So this is all within the same medical practice in house. So that you don't have to see the patient, you can ask the nurse practitioners to, because that's what our nurse practitioners do, is they actually do direct patient care in that way. And we can, and then they're under me as a collaborator or someone else as a collaborator. And it's a different route of liability, if you will. And I think that's an appropriate way to do it too. If you ever feel that a patient needs to maybe be directly seen, you do not have to do that as the medical director. You can send them to our telemedicine platform. Obviously send them to us and we'll get them on the telemedicine platform to be seen and evaluated that way.
Yeah, that's a really good idea. But I think some of these clinics, and not just these 3, they think that because we're the medical director, they can just call us and we can give permission. I mean, they're under that. They don't understand that I'm not their boss.
That's true. Yeah. And that is one thing, again, I think I see Archie nodding his head, because that is something that we've recognized. I think it was, we're working on educating and setting expectations much better now too. And that's one thing as we're revamping this whole process that we're really taking time on. Full disclosure, we had an outsourced sales team for about 6 months while I was making some transitions. And I think that they just started promising people whatever they could to make the sale. So we have a little bit of a group of clients that we're resetting expectations and educating to. And again, and a lot of times it's re-education as well. So if you ever run into that too, feel free to ping us directly and say, hey, I think this clinic needs a little more education on how this works. That's what we do. We're happy to do so. And again, we can do it pretty well now that we've figured it out. So, but yeah, no, very, very, thank you for bringing that up, because that's a really good thing to share with everybody is, how do you handle those kind of situations, and exactly how you handle it is perfect. And again, feel free to send them to the telemedicine platform if they need direct patient care, so we can do it that way. Obviously, you can speak to their protocols. You are covered with malpractice insurance in a way that if you were to give direct patient care, we've got you covered. And never hesitate to send them back to us for some re-education if they need it, or reset expectations. We're happy to do so. Mary, please.
Quick question, Chris, on that piece. When I try to avoid providing any kind of advice, and I certainly don't take calls from the clinics. I try to avoid that. I try to take it all through the platform. But if, as the situation Alan described, where he is providing them some advice, is there a way to document that so that we're protected, or is the expectation that the clinic's going to document it? So if you advise them that they can go outside of protocol, I can't imagine malpractice is going to cover you unless there's some documentation.
That's a really good point. That's a really good point. Now that we have these full EMR integrations, that is something that we can do. And we actually have, in a lot of cases, already have a patient chart because we either did the clearance through the nurse practitioners or we did something else. I think logistically, let me think about that a little bit and how to maybe roll that out in an easy to use fashion. But I think that is a good point. So even if you were, even like, if it happens in an hour from now after this call, if you want to document it simply like on a Word document and send it to us, we will make sure that gets into the client's EMR or the clinic's EMR. That is a very valid point. And let me look at some solutions, Mary, Archie, at maybe potentially getting the medical directors access to the EMR, at least so that for those types of specific things, if they needed to, they'd have a place to go and document and chart. I think that it's definitely something we can do. So.
Are the chats between us and the clinic something that's saved into the EMR? Because a lot of times these questions come to me from the clinical help desk through like a chat with the clinic, and we respond with a clinical question that way. Are those saved after they're closed?
They're all saved. Yes, they're all
Okay.
archived and saved. They can be referenced and pulled if needed. People don't have access to them through Guardian. Like I'd have to call my CTO and say, hey, I need you to pull, and we would get permissions from you guys. So it's HIPAA compliant that way. But yes, they all are archived.
Okay.
And that's actually an interesting thing too. Now that we have the EMR integration, is there a way to pull some of the communication pieces and document it as a part of the patient chart? And maybe as we look at how we do that, we do it only if we want that, because sometimes you don't want to over document either a conversation.
No,
So, but just so you know, they all are archived. They all are referenceable. We can pull them at any time. We have in the past for different boards and stuff too, just to show it. We can always show a record. So yeah, so we have that today, which I think protects us for the here and now. But I really like that idea of looking at where could the medical directors also potentially chart. And I think now that we have these EMR integrations, there's probably some really cool ways we could get that set up where we're putting it all together in a good way. So I'll make a note. Mary, did you want to add something?
I was just actually, and you actually touched on it. I was actually just going to say, like, if there was an escalation with a client for their patient, you can always check to see if we did do their good faith exam if they don't have an NP on site. You can also reference their good faith exam, and that can be requested as well because we do have records of those.
Yeah, and another route to do it too would today just include Jason and I. So hey, just so you know, this client reached out. Here's what I suggested, because Jason and I can document it as an incident report as well, and then get it in the chart and that type of thing. But that's a really good point. I think building out that functionality would be a really cool feature to build in for the medical directors to have, and really kind of build an opportunity for some good continuity of care. So I appreciate that suggestion. Any other questions anybody has about those changes at all? And again, expect to see some of that in the next 2 weeks is when we're really looking at rolling that out. So again, the only thing I would just reiterate is just encouraging you guys, if you can, just like, first of all, I will thank you guys all, because the majority of you are monitoring documents on a daily basis, and that has made such a difference in the client experience and compliance and getting people set up the right way. So please, again, we encourage you, if you can, on a daily basis, just to be checking in there to see if there's any documents or charts that need signed. But if you could do the same with the chat function, just to make sure if we did potentially try to pull you in. I also, a lot of times will reach out personally as well if it's something that I need you for. And I'm the only one who's allowed to do that. So just so you know. Cool. All right, awesome here. We've got a couple more minutes, and I promised you I wouldn't go over. So we kind of went through the majority of things today. Only other thing I guess I'll take a minute to plug is that, as we're looking to, again, really push the gold standard of medical oversight. We talked a lot about on this call how that really feeds into education, not just clinical education, well, not just business education and compliance education, but also clinical education. Guardian is launching our first conference where it's the HEAL conference. So it stands for the Health Education and Advanced Learning Conference. So HEAL, it'll be in Tampa, Florida, because I was because Alan did not let me put it in Michigan. So that's the other thing too. We listened to our medical directors, because when I first said it was going to be in,
That was the dumbest.
it
I
was
can't even, how do you even admit something like that?
it was, and I took that feedback. It's now going to be in Tampa, Florida, in March.
You're welcome, everyone.
Yes, you can thank Al. But we would love to have you guys there. So if you go to HEAL, HEAL, healconference.com, you guys can see kind of where we'll be at. The purpose of this conference is not a business conference. This is really the conference that I kind of wish I had always had as a young clinician, to figure out, hey, where can I go to learn high quality accredited information on cutting edge medical technologies, right? Where can I go learn about stem cell therapy in a legitimate fashion where the content is accredited and it's actually learned? So we have, Guardian has the ability to accredit both EMS and nursing credits nationally. So we will be offering continuing education credits to our nursing and EMS professionals at this conference. And we're really, again, we're not focused on, we'll have sponsors and stuff, but we're really focused on bringing in clinical educators who can provide really good education on the clinical aspects of the cutting edge medicine that a lot of people are interested in. Right now we have Dr. Steve Rallis is coming in to speak on high dose vitamin C in cancer supportive therapy. We have someone coming in to speak on ozone therapy, functional medicine, hormone replacement and optimization, peptide therapy. We've got a lecture on microplastics and how that's affected. I mean, there's a lot of really cool things, but it's from, vetted clinicians where we're actually accrediting the content for clinical education. And we would love to have you guys there. If any of you are interested in speaking, also, like I said, please let me know. We'd love to have maybe some of our own medical directors speaking. I think that would be just an amazing thing. But one, we'd love to just hang out with you and spend some time. Two, I think there's going to be a lot of good clinical education. Yep, there it is. A lot of good clinical education for us as physicians as well. We don't have the ability to accredit the content for physicians quite yet. I'm working on that. But again, just a really good time, a lot of great education, and would be great to, if any of our medical directors are available and want to come up for it, we'd love to have you. So very excited about that as well. Again, I think one of the things I'm striving to do is that not only do I want Guardian to be, and I really think we have already become in a big way. Yeah, that's one of our most handsome speakers right there. Yep, that guy, he'll be there. But not only do I want Guardian to be the gold standard in medical oversight, which I think we have, I think we are doing. I really do. I think the feedback we've gotten on a lot of different fronts is that we are doing that well, and we will continue to do that well. But I really think as a part of that, we then need to take a leadership role, and again, in the clinical education side of a lot of this stuff too. So HEAL is kind of our inaugural way of stamping that as, hey, you know what, we're here to do that and to do it well. So again, we're really excited about that. So feel free to reach out to us if you're interested in attending. Or speaking. That would be great. So,
what about Mary? I mean, Mary is, and I'm putting in a plug for Mary because she is my BFF. I mean, how many people do we know that can handle the things? Like, there was a question I got from the California Medical Board about a clinic issue. I had nothing to do. Mary took care of it like nobody's business, like we were watching Law and Order SVU. And, I mean, she was Mariska Haggerty. And so, I mean, I think you'd be, Mary's well-spoken and an expert in that field. I think that'd be a great idea. I just thought
no, absolutely. No. And I think that's one of the things too, is that even some of the topics like how to navigate a board inquiry that a lot of times we as physicians don't even know, let alone, like I said, like nurses and stuff like, and that's stuff we can accredit as well. So absolutely. I think that's a great idea. I love it. And that is one thing I as we finish here, again, I want to thank you guys as our medical directors for doing such a good job and making such a big difference on helping us do this well. But I really do want to kind of commend my team. I really feel this past year, I finally really have a team of the right people in the right seats who bring a lot of value to you guys, which means that they're bringing value to Guardian as a whole. So again, I'm very happy with where we're at and where we're headed. But again, there's always things we can improve on. So please, never hesitate to reach out. Again, with things that you'd like to see. How can we make it better for you? Again, if we can create a platform and a business that you guys are proud to be a part of and that you're excited to be a part of, then we can't lose. So that's the goal, and we'll continue to strive to do so. So we got 2 minutes left here. I will leave it up. If there's any questions, comments, concerns, please let me know. I'm happy to stay on a little bit after if anybody needs to. Otherwise, thank you guys so much again for carving out the time. We will send this recording out to those who couldn't make it, as well as you guys to reference back. Again, thank you for everything, and I'm excited to give you updates as we move forward.